We're at Arkansas Surgical Hospital in the family side of these amazing suites talking to Dr. Dana Abraham. She is a breast surgical oncologist. It's great to talk to you. So this may look a little unusual. People are wondering where we are right now, but this is just a part, like the family side of the room so that people are comfortable.
That's why I love bringing my patients to Arkansas Surgical Hospital, because they have their own room. The family has their own room and the patient has their own privacy.
Yeah, that is great. I mean, there are a lot of people that want to come in, they want to visit, and you need that support when you're going through something like this.
Especially with breast cancer, yes.
Do you find that people are surprised that you can do these type of surgeries when it comes to breast? I mean, people think of Arkansas Surgical Hospital, maybe they think of knee replacements, but this is something you do here too.
Yes, I'm primarily based out of Arkansas Surgical Hospital, and I like the quality of the care, the caring for my patients. Everybody's very kind and lots of attention to detail.
Right, and it is October. We're talking about breast cancer awareness this month, and there are some myths that people have. And I think it's funny because even as a woman at my age, I still look at these and think, oh, okay, I've thought that my entire life. So what are some of the biggest myths?
So some people think that if you don't have a family history of breast cancer that you won't get breast cancer, and unfortunately family history is a risk factor, but the main risk factor for getting breast cancer is being a woman in America growing older. Right. And so not having family history is not protective, right. It just means that you don't have that as a risk factor.
So you still need to get the mammogram even if you do not have it in your family.
Exactly.
What else? Is there another myth?
Some people think that if you have breast cancer, you're going to need to lose your breast, and that's not true. The earlier that we catch breast cancer, then the more options that you have, and we now know that there's no improvement in survival by removing more normal breast tissue, and so we can offer many ladies lumpectomies.
What about pain in the breast? Is that something that you think, well, it must be breast cancer?
Pain in some parts of your body does mean something, like your shoulder or your knee or your hip, but in the breast, pain is just part of having breasts. They're hormonally sensitive, they're sensitive to the salt in your diet, the concentrated sweets in your diet, and so pain very rarely means breast cancer.
Right. Is there any other myths that people come to you about that really stand out?
Some people think that if you put a needle in breast cancer and do a biopsy, that that's going to spread the breast cancer, and unfortunately it's not that simple, because breast cancer has the ability to spread to other parts of the body even without manipulating it. So we use needle biopsies very frequently so that we can plan what type of surgical intervention, and there are types of breast cancer that need preoperative treatment.
If someone is watching right now and they have a concern, what do you suggest is the first step?
The first step is to contact your doctor and let them know what your concerns are, so that they can schedule appropriate imaging. Imaging, be it an ultrasound or a mammogram, or sometimes an MRI, can be scheduled by your primary care doctor, and any abnormalities can be worked up at that time.
Thank you, Dr. Abraham. And if you have any more questions about what they offer here at Arkansas Surgical Hospital, go to the website. It's arksurgicalhospital.com.